right, so say who you are.
I'm David Dorfman. I'm a pediatrician and I live in Massachusetts.
And I'm Carol Eastman. I'm a family doctor and I also live in Massachusetts with David Dorfman.
Excellent. So tell me a little bit about what you did this week.
Oh, it was quite a fascinating week. We started out working in sort of with basically these pop-up clinics in the first couple of days with mostly poor population, people around the Cusco area, followed by working in an orphanage. And I'll let you complete what else we did.
Let's see. I'm forgetting now. The fourth day was, which one was that, Sarah?
We went up to the community.
When we went up to the community.
That was amazing.
I knew it was a different day. That was an amazing day.
That was amazing.
So we went out way up into the mountains and took care of an entire community, which was about 83 people, I believe. And so adults, children, old people. We saw almost everybody, probably not some of the sort of healthy aged men who decided to forego the clinic, but it was just really amazing to see a whole town, and the care we provided, I think, was really important to them. I also really hope that there will be an opportunity for another team of doctors to go back next year, or even ideally it would be every 6 months, because for this community, I think having some continuity for what we were able to get started would be tremendous.
It was also eye-opening for us because we got to see the school and see their facilities. I was so impressed by the school they had. There was a 2-classroom school up in the mountains, and to meet the teacher who runs the whole show there, and to exchange gifts with the community. They gave us products of their agriculture, and we gave them blankets, which was, they were very appreciative, and so were we, and they danced for us, the little kids, and it was a blast.
Fantastic. So tell me a little bit, Carol, about Friday.
Friday was the last day. We were at an orphanage again, or it was kind of a home for young women. Many of them had very troubled and difficult backgrounds, and so it was partly helping them with medical questions. The orphanage was very impressive in itself, though. It had a full-time psychologist who worked with the girls who were there most days, I gathered, and really a kind of a wonderful program of teaching ceramics, and so that as a sort of therapeutic but also means of giving them a skill and something that they can then use to make actually really beautiful ceramics that we were then able to buy from them. But the girls themselves had been through a lot, and there was sort of both medical help and just, I guess, being friendly and supportive as part of it also.
So what was your most memorable moment?
Let's see. There are a bunch of them. One of them actually is just that I had gotten a lot of medications from a group called AmeriCares, and and when I went through picking them, I had cared for a lot of Central American patients in the United States. So I was trying to sort of think like, okay, what kinds of things would I need for actually a somewhat similar population? And one of the things that was on the list that I selected, because I thought, well, you never know, and if it's helpful, it will be really helpful, was eye drops for glaucoma. And then on the first day of one of the clinics, or maybe it was the second day, the pop-up clinic, a blind, almost blind man came in who had been diagnosed with glaucoma, so it was very clear what his problem was. He knew this, but was not able to get his drops, and so I was able to give him a year's supply of eye drops, which was just pretty great.
Oh, that's amazing.